Hi, my name is Sarah Griffin. I'm the owner and founder of Edge Clinical Nutrition, and I'm going to tell you why you need this CNSC exam study guide to pass the exam. This CNSC exam prep session is designed for people who are taking the exam in the next session. So I'm recording this in September 2025. The fall exam is coming up in October. The exam session opens up in a couple of weeks. I recommend you watch this for 2 to 4 weeks before you sit for your exam because it's got some great material in terms of what to expect, how to prepare, last minute things, and how you should spend your next 2 to 3 weeks studying. So first of all, calculations. You will have access to a digital calculator on the CNSC exam, but one thing that you might not realize is how much of your clinical work you rely on your charting system or any kind of spreadsheet or app that you use. So for example, have you calculated BMI from scratch before? I know it's not a very complicated equation, but typically our charting system just provides us the patient's BMI. You actually have to think about, what is BMI? Kilograms over meters squared. Okay, that actually is interesting. How do I convert from pounds to kilos and from inches to centimeters? So you should be able to calculate BMI from scratch. Obviously, you'll have a calculator, a digital calculator, but you won't have any type of equation or system that just like feeds you the patient's BMI. And they love to ask questions about how much energy and protein a patient needs and give you the patient's body weight and height, but make you calculate their BMI to determine if they're obese or not. So my study guide will show you exactly which calculations you need to memorize. This study guide is really, really great. I've had over 150 dietitians trust me to help them pass the CNSC exam. It is over 80 pages long. And the thing that really sets my study guide apart is it's not a Cliff Notes version of the Aspen Core. So there's some products out there that are a Cliff Notes version of the Aspen Core, meaning like a summary of the entire Aspen Adult Nutrition Support Core curriculum. And I'll tell you why it's really important that you use my study guide that's really focused after the exam itself, specific to the test and specific to the CNSC exam today and how much it's changed. And this is why. The Aspen Adult Nutrition Support Core Curriculum, third edition, soon to be 4th edition, is currently the resource for the CNSC exam. So yes, the 3rd edition is still the resource that you use for the 2025 exams. In 2026, they'll be using the 4th edition, kind of as the book for the CNSC exam. But the Aspen Core is a textbook. It is not representative of the CNSC exam. I'll say that again. The Aspen Core is not representative of the CNSC exam. And the people who write the exam, one of the person who chairs the NBNSC board that administers the CNSC exam, Dr. Ye, he actually is in Denver, and I'm in Denver as well, and I've communicated with him. And he's confirmed that the 3rd edition of the Aspen Core is the book for the 2025 exams. They'll move to the 4th edition in 2026. I don't expect the content to change substantially, but just so you know, there are some differences between the 3rd and 4th edition of the Aspen Core. I do still recommend students actually use the 4th edition, the current most updated edition that was released in 2025, because it's got the information, really the ICU energy and protein guidelines after the perfect and the effort trial. Those are the big differences between the 3rd and 4th edition. And the 4th edition is expanded, it's much bigger, etc. It's a fantastic resource. You have to have a copy of the Adult Aspen Nutrition Support Core Curriculum, ideally the 4th edition, to pass this exam, but it's not representative of the exam. So, for example, there's a huge section in the Aspen Adult Nutrition Support Core Curriculum about carbohydrate metabolism. Carbohydrate metabolism is a very small component of the CNSC exam. The ethics chapter of the Aspen Core book is very small and kind of at the end, sort of like as an afterthought, like here's an ethics chapter. Whereas there's actually a lot of ethics content on the CNSC exam. So if you use a study guide that's a Cliff Notes version of the Aspen Core or something that is representative of the Aspen Core itself, it's going to give you great clinical material, but it's not going to help you study for and pass this exam. It's not going to give you all of the content that you need. So my study guide is specifically broken down based on all of the content domains and sections of the exam. I show you exactly which domain, which section. This is probably kind of fuzzy on the video, but you can kind of see how it's laid out. So monitoring, okay, exactly. Part T26, topic domain T26, T27, T28. It runs through the whole outline of the CNSC exam and tells you exactly what you need to study for every single portion. So yes, you need a copy of the Aspen Core. You don't need to get the pediatric Aspen Core, but get a copy of the adult Aspen core curriculum, ideally the 4th edition. Like I said, the 3rd edition is kind of like the de facto one for the 2025 exams, but you're going to want to get your hands on the 4th edition because it's expanded, it's updated, and I don't expect the content on this exam to change substantially just because the version of the Aspen core is different. Okay, so in my study guide, it'll show you exactly which calculations to memorize. You need to do BMI from scratch, ideal body weight, energy and protein needs for most disease states. So if you have a Crohn's disease patient, how much energy and protein do they need? Be sure to look at renal. So your CRRT patients, how much energy and protein do they need? Patients with trauma, burns, wounds, things like that. If you don't want to look this up, my nutrition support skills course has a fantastic resource that'll show you the energy and protein needs for every single disease state. So this, it's hard to see in the picture, but energy and protein needs for every single disease state. There's a pediatric resource and an adult resource in my nutrition support skills course. This doesn't come with the CNSC exam study guide. It's an additional purchase on top of that. And the nutrition support skills course is an excellent kind of refresher for nutrition support, and it provides 23.5 CPEs. So if you want more tube feeding and TPN content and all of these great clinical resources, you can purchase that and get the CPEs on top, which is awesome. Okay, but the energy and protein needs for disease states are listed in the CNSC exam study guide. They're just not listed in this nice table format, which is like a nice clinical resource that you can bring to work with you. They're just listed more of like as an outline. But there's the vast majority of this study guide actually is energy and protein needs for disease states. So it just goes on and on and on. Pancreatitis, kidney disease, IBD, hyperemesis, HIV/AIDS, food allergies, diabetes, sepsis, ECMO, critical illness. I provided every single disease that you might see on the CNSC exam. Woo! And specific energy and protein needs for each, and then also important things to keep in mind. So for example, if you've never seen a patient with a chyle leak, you might not actually know what color chyle is, which could be a question on the exam. What type of, does MCT oil require chylomicron formation? Nutrient needs for chyle leaks. How much energy, protein, and lipid would you add to a PN for a patient with a chyle leak? So that's all listed in here for you. That content, of course, is in the Aspen core, but it's kind of scattered throughout. So I've taken all of the information in the Aspen core and really combined it into this great outline that just shows you like, boom, energy and protein needs and considerations for most disease states that you could see on this exam. This is actually a really great clinical resource to keep with you too. I have a lot of students who take the CNSC exam and they just keep this binder at work because it does provide a nice outline and kind of that you can look back and say like, oh, I have a short bowel syndrome patient today. Instead of like paging through journal articles or flipping through the Aspen text to try to read like 60 pages on short bowel, I can just look, boom, boom, boom. This is exactly what I need to know. How much energy and protein, et cetera, et cetera. You should know basic nutrition support calculations, including percentages. So tube feeding, you should be able to calculate cyclic, bolus, intermittent feeds, energy and protein. And then if they give you like your formula has 30% of calories from protein, you should be able to calculate that. And then for PN, for both PPN and CPN, you should be able to calculate a basic order in terms of like how much macronutrients to put in. They probably won't ask you about electrolyte salts to customize salts. I do teach you how to do that in my course and my study guide, but they probably won't ask you to do salts per se, but more macronutrients. So be sure that you know how to calculate tube feeding and PN orders. And a lot of people actually aren't allowed to calculate PN orders until they have their CNSC. So if you haven't written PN orders by yourself, a PPN or a CPN by yourself as a dietitian, in the CNSC exam study guide, there's an online course component and it will walk you through my TPN calculation cheat sheet, which will show you exactly how to calculate a PN order if you haven't done that before. And there's a video lecture that shows you exactly how to calculate. And then there's 4 case studies that show you how to calculate various different types of PN. And then there's a video answer key. So I don't just throw answers at you. I give you a video answer key that walks you through every single case study. And so you can really understand the art as well as the science. So many of the questions on the CNSC exam are going to be pretty difficult to answer because you might not always see the answer that you would like. And so much of nutrition support is more of an art than a science. So there might be a lot of correct answers. You just have to choose the best one. Okay, so other things to memorize. The Holiday Sager method for fluid is really important because you might be given a pediatric patient. And that fluid estimation is based on body weight in kilograms. So that's a really important one to memorize. If you don't work with pediatric patients, you probably don't know what that is. It's in the study guide. So be sure to memorize that so you can calculate how much fluid does a pediatric patient need between 1 and 25 kilograms of body weight. The total body water equation, free water deficit, and corrected calcium. So we might not use these very much in practice. Some of these are kind of old school, things that we don't typically use anymore, but they might be on the CNSC exam. So you definitely do need to memorize them. Okay, in terms of the exam itself, so this might seem redundant if you've taken this exam before, but things actually have changed. So if you're taking your 5 or 10 or 15-year recertification, don't tune out because the exam actually has changed, and I'm going to explain why. And then for those of you who are first-time test takers, this is going to be really critical for you to understand. So be sure to pay attention for this portion. So what does it look like to actually come in and sit down and take this exam? You can bring one item into the testing room with you besides yourself. It's a clear water bottle without a label. Now, I know this sounds really funny, but this was the thing that tripped me up the most. I took my CNSC 5 years ago. I retook it last fall, and I was like, I got this. No biggie. The water bottle thing tripped me up so much because I have this big stainless steel water bottle. I don't actually even own a clear water bottle, and we don't have any disposable water bottles in our house. So I had to drive to the gas station on my way to the exam and buy one. So do yourself a favor, do a dry run. I really, really recommend anybody, if you're taking your research or if you're taking your exam for the first time, it doesn't matter who you are, do a dry run. So if your exam is on October 6th, which let's pretend is a Tuesday at 8 a.m., the week before, you're going to do a dry run. You're going to get yourself up. You're going to get yourself ready. You're going to get in the car with your water bottle. You're going to bring your ID. You're going to bring any last minute things that you know you want to memorize. Just write them down on a sticky note and have your last minute things that you just want to have right in front of you before you walk into that exam. You're going to drive in traffic to the exam. Get there 30 minutes before you're supposed to check in. Park, walk in. Walk up, take the elevator up or the stairs up to the room and lay eyes on the PTC testing room and be like, that's where I need to go. And then go get yourself a coffee and drive yourself home. A dry run can really help reduce anxiety. I know it seems basic. I don't need to do a dry run, but you'd be surprised. There can be traffic. There can be construction. When I drove to my exam. I didn't do a dry run. So do what I say, not what I do. I did not do a dry run when I took my recert last fall. There was construction, so the parking was changed, and they last minute the morning of was oh wait, you have to park in the far lot, and then it's a 15-minute walk to the building. So I was rushing in, and then lo and behold, the elevator is broken, and the testing room is on the 5th floor, so I had to walk up 5 flights of stairs. I was coming in all hot and sweaty and super just disgruntled and full of anxiety. And let me tell you, people who are calm and cool and collected on exam day and can really just focus on the content and not all of the other stuff that has to do with exam taking, those are the people that do the best. And this is why a lot of people will take practice exams for the SAT and the ACT test that we used to have to take in high school, because you take a test 3 or 4 or 5 times and you get all of that anxiety off the table and you can actually focus on the content. Now, we don't have the luxury of taking a practice exam for the CNSC, but do whatever you can to reduce that day of anxiety burden. So do a dry run, drive there, make sure you can get there in traffic at the same time that you would actually show up. Have everything ready for you so you don't have to think about it on exam day. Everything looks familiar. I've been there before. I've done this drive before. I know where the room is, etc., etc. Got my water bottle. Bring your ID. So your ID has to match your test registration exactly. So if you've had a name change recently, you need to make sure that the name you registered with is the same as the name on your ID. And typically we'll just use a driver's license in the US. You can't have any jewelry on you other than a wedding or engagement ring. So don't come to the testing center with extra jewelry that you have to take off. They will pat you down. They will check your pockets. You can have tissues if you're sick. They'll give you earplugs. You can have nothing else in the room. You can bring food, you can bring snacks, drinks, and a bag or backpack with you. They'll put that all in a locker. The exam is 4 hours long with one 15-minute break. So there's 2 parts to this exam, and you cannot go back after you finish part 1. You do part 1, you take your break, then you do part 2. You can't go back to part 1 once you click Finish Part 1. Now, this is different. The exam used to be you could go back and forth between the parts. That's changed. So the best way that I strongly recommend you go through in terms of like the exam flow is this. Start Part 1. Go through every single question in sequential order. The questions are randomly organized. I believe Part 1 and Part 2 are going to have the same content, but then they kind of mix up the questions so that you can't come out of the exam and text your friend and be like, that last question was a doozy, because she might have gotten a different last question. But they're all the same questions. You don't get them in the same order, but you get the same questions. It's also, as far as I'm aware, not a responsive exam like the RD exam where they kind of throw different questions at you based on what you get right or wrong. They just give you like the same set of 250 questions. And I'm really not sure exactly how many questions are in Part 1 and Part 2, but I think they're approximately equal. So go through Part 1 in sequential order, answering every question you can. If you can't answer the question with like a good degree of certainty within about 2 minutes, move on. If you think like, oh yeah, I got this, I know what this one is, in about 2 minutes, pick an answer and then move on. But if you're like, I'm stumped, don't sit for 3 or 4 or 5 minutes on each question. Just do about 2 minutes per question. If there's a question that you can't answer in 2 minutes, flag it. You can click the flag button and then move on. Once you've answered every single question that you can, and don't guess, just answer the ones that you're confident on, flag the ones you're not confident on. Then go back and go through the flagged questions in sequential order. Do not change any of your initial answers. We know that if you change your answer, you're more likely to get the answer wrong. So sometimes you need to go with your gut. But the first time through, you're not guessing. You're only answering the ones that you're really confident on. Now you're going to go through and do the flagged questions. Answer any flagged questions that you can. If there's some that you're like, I absolutely have no idea, don't waste time on it. Just keep it flagged and move on to the next one. At the very end, you're going to have about 5 or 10 questions that you're like, I have no idea. And you're going to have to guess. And the best way to guess is to pick 2 answers that you know are wrong, eliminate those, and then randomly choose one of the other options. Don't spend a lot of time thinking about which one I'm going to guess. Literally just randomly guess. And we know that if you employ this method of strategic guessing, that actually has the best potential. If you try to use some type of system, like I'm going to answer A for this question and B for this question and C for this question, or I'll answer all of these question B and then these, don't do any kind of system. Just narrow it down to 2 that you think might be correct and randomly choose one. And try not to change any of your answers. This is why I don't recommend guessing in the first pass through Part 1. I don't recommend guessing, because if you're guessing, then you're probably going to go back and be like, oh, I guessed on that one. I should probably change my answer. Don't guess. Through the first time you go through, don't guess. Just flag the ones that you don't know. Okay? And then finish Part 1. Go ahead and take your break. Take a few deep breaths. Go to the restroom. Close your eyes for a minute and rest. You get about 15 minutes on your break. And then go back and do Part 2 and do the same thing. Go through Part 2 in sequential order, answering every question that you're pretty confident on. Within 2 minutes, flagging the ones that you don't know, then go back through and do the ones that you flagged, answer everyone that you're pretty confident on. At the very end, you'll have 5 or 10 that you still have flagged and you're like, I just have to guess on these. Eliminate 2 answers that you think are wrong and then go ahead and guess. You can go forward and backwards through each section, but once you finish Part 1, you're not allowed to go back to Part 2. You can actually take some unscheduled breaks, so I did do this. I was getting pretty tired towards the end, so I did take an unscheduled break during Part 2. I had gone through it once, and then I flagged 10 questions. I took a break, I rested for about 10 minutes, and then I came back and answered the last chunk of questions. So the candidate handbook, and I'll link this in the bottom, the NBNSC board, which administers the CNSC exam, they release a candidate handbook, and it's really helpful. It's got all the nitty gritty about the exam. The last few slides on this PDF are actually the most important. They've included, and this is kind of new, they've included some details about what the exam computer looks like, which is really helpful. Again, this will just lower your anxiety on exam day because you're like, oh, I've seen this before. I know what this format looks like. I know what the functionality of the computer is. Especially if you're not super tech savvy, take some time before exam day to really review the last few slides of that candidate handbook so you feel really comfortable operating the computer and flagging questions and things like that on exam day. One other thing that I want to mention, I think it's on this slide actually. Yeah. So they used to, if you took your exam 5 or 10 years ago and you're taking your recert, you're probably used to having pre-questions. There were like 30 pre-questions that they're using for potential future exams, but they're unscored. They're just for validity. They would give those to you and then you do the pre-questions. They're like, we're not going to score these. You finish those, you click start exam, and then you enter into the scored questions. They've changed the exam. So now all of the pre-test questions are interspersed into the other questions. So there's 220 questions plus 30 pre-test questions, meaning there's 250 questions on the CNSC exam. And those pre-test questions are sprinkled throughout. So you don't know which ones are graded and which ones are ungraded, which actually makes it really hard. But the one thing that I would like to remind you of is you can get a lot of questions wrong on this exam and still pass. So if you're sitting there on the exam day and you're just like, oh, this is so hard, I feel like I'm doing terribly, I just want you to remember me saying, you can get a lot of questions wrong on this exam and still pass. The scoring scale is 200 to 800 and a passing score is 500. Now, in terms of content, you can see that on the screen. It's 31% nutrition assessment, 57% clinical management, 5% process management, and 7% professional practice. My study guide is organized in those specific sections. And those change a little bit, like a couple percentage points, but largely are the same, meaning like the vast majority of this exam is going to be clinical management. So how do you manage a tube feeding or PN patient? So I did put the pass rates up on the screen. Now, these are from the NBNSC board. You'll see fall in the dark blue and spring in the teal. Now, something that might be a little weird to you on this image is where are the rest of the pass rates? Like, why don't we have pass rates after spring 2022? This is a freshening part of the CNSC exam, specifically for me as a teacher. They haven't released pass rates publicly since the spring of 2022. And so what happened was the exam was too easy. Around 2020, 2021, pass rates were above 90%. And so they adjusted the exam to make it harder. A 90% pass rate is far too high for an exam like this. So the board made the exam quite a bit harder. Now, these pass rates look very high. I guarantee you they are not this high anymore. I'm not sure exactly what percentage the board is shooting for in terms of a pass rate, but the exam has gotten substantially harder in the past few years. I took the exam in 2019, my first time, and passed. When I took my exam in 2024, I noticed a big difference. And I was shocked because I had been working in nutrition support for those entire 5 years. I was working in nutrition support. So I was like, I should be better at this, not worse. I have had so many people who have held their CNSC credential for 10, 15, 20 years tell me this new exam is so much harder. So I don't say that to scare you, but I say that to say you need a study guide. The exam is not the same as it used to be. It is so much harder. They haven't released pass rates, so we don't know what pass rates look like, but we know that it's much harder. So scores are available. They send the scores to your email inbox, about 4 weeks after the exam window closes. So November 17th would be the earliest that I would expect the fall 2025 results to be out. Now, I will say for spring 2025, they actually came out like a full 2 weeks after I expected them to. So they might be a little tardy. So don't freak out if you don't get your results right away. That email, notices@ptcny.com. That email address sent you your code so you can book your exam. So you've probably gotten emails from them before, but go ahead and add that to your email contacts so that doesn't go to spam. So as soon as they email you, here's your passing score, here's your rate, here's your score, that doesn't go to spam. Make sure that you add that to your email contacts so you can easily receive email communication from them. And they're not just going to send you an email with your score. They'll send you like a link and you can click on the link and you have to type in a certain password, I think, which is like your birth date or something, or maybe you have to type in your booking code, and then you'll pull up this PDF that'll kind of show you your number score, so between 200 and 800, and then what percentage you got correct of each of these individual categories. You can reschedule your exam 5 days before your exam. You can't reschedule after the exam window has opened. So you have to do it before the exam window opens. If you really want to push it back, it's a $50 fee to push it back to the next section. I actually often discourage students from rescheduling and say, just take it. it's so helpful to have at least one exam experience under your belt, even if you go in being like, I'm probably not going to pass. I only studied for 6 weeks. That's not enough time for this exam. I recommend 4+ months of studying for an exam of this caliber, especially if you're a first-time test taker. So I strongly recommend just going for it. If you can afford the test fee, take it, lay eyes on the questions, see how you do, and then you can take it again the next session. Okay, so in terms of test taking tips, some really important things to keep in mind. Employ a strategy of strategic failure. Okay, what do I mean by strategic failure? You can choose one thing, maybe two things that you're just like not going to worry about. If you're sitting here 2 to 4 weeks before the exam, now is the time to decide what are you going to focus on and what are you going to strategically fail on. I'll give you an example. Micronutrient assessment was always difficult for me. I could easily understand and memorize which foods have thiamine in them, what signs and symptoms of thiamine deficiency look like. But in terms of what is a normal serum thiamine, or, I mean, we don't even really do that because it's a water soluble, but what is a normal serum vitamin D? What does vitamin D deficiency look like in a pediatric patient? Like, those numbers just would not stick in my brain. So I employed the strategy of strategic failure, and I was like, I'm not going to worry about it. There might be 3 to 5 questions about this on the exam. I'm just going to guess on all of them, probably. And I'm going to focus instead on the things that I can know and the things that I'm really certain on that are going to probably get me more points anyway. So you can't strategically fail on pediatric content. You can't strategically fail on like all TPN calculations. But if there's one thing that you're just like, I just cannot get this down, and it's like a small portion of the exam, I give you permission to strategically fail on that and be like, I'm just not going to worry about serum lab values for fat-soluble vitamins. I'm never going to know that. I'm never going to commit it to memory. And instead, I'm going to work on memorizing these equations: total body water, corrected calcium, nitrogen balance, those types of things. I want to point out a couple things. I just did an Instagram Live CNSC exam prep session, and I had some really good questions in there. So people ask questions about catheters. Should I study catheters? Should I study micronutrients? Should I study nitrogen balance? And the answer to that is micronutrients, I would say, is a lesser portion of the exam. I wouldn't worry too much about, do you know backwards and forwards what a normal serum vitamin A looks like? I don't think that's critically important to this exam. And it's going to take a lot of your energy to memorize all of that. What you do need to look at is like catheters, catheter occlusions. What does it look like? Different types of occlusions that can happen in your central line and in your catheter. And some occlusions, some clots, you can take blood, so you can withdraw, but you can't instill. So you can't administer a TPN through this PICC line, but for some reason you can draw blood through it. So there's certain types of clots that can form in the inside, like the lumen of the PICC line or the central line, that can cause a bunch of different symptoms. And this is much more of like a nursing competency, but it's really important that as dietitians we're prepared to answer these questions because they will ask you about it on the exam. So there's certain types of blood clots that like can form like a little tip on the edge of the catheter, and it'll kind of form like a little scab almost. And so when you try to push fluid through it, it'll just pop up on the top and you can push fluid past it. But when you try to draw blood out, it'll kind of suck up against the back end and you can't draw blood out. So being aware of those different types of catheter occlusions, how do you use an antibiotic lock in a PICC line or a central line? Also how to care for PICC lines, central lines, and G&J tubes. So what can you use around the G-tube site? Warm water and soap. What kind of things can corrode the skin that you're not really supposed to use around there? Can you put secure bandages over PEG tubes? No, you're really not supposed to do that. What happens if your bumper is loose? What happens if your bumper is buried? What happens if there's granulation tissue? What can you use to kind of cauterize that granulation tissue? All of those things are in my CNSC exam study guide. If you work in inpatient dietetics, you probably have never had to learn any of that. It's much more of a nursing kind of home health competency, but those are really important. So I would absolutely spend the next 2 to 4 weeks before you take your exam focusing on those types of things. pediatric content, medications. What does cracking and creaming look like in a PN? I've got some great pictures in the digital appendix that shows you what a cracked PN looks like and what can make it crack. Different medications that I'll review at the end of this slide that may or may not be compatible with a 3-in-1 versus a 2-in-1 PN. I would really spend the majority of your time focusing on that and not worrying so much about things like micronutrient assessment. Okay. Not all answers will be present. This is very frustrating because you might look at a question and be like, I know the answer and it's not here. What the heck? So the exam is intended typically for you to choose like the best answer. That's kind of what we tell our D exam students as well. You might not see your answer present or the answer that you want to be present, but you're trying to choose the best answer of the options. Try not to be distracted by an answer that's factually accurate but doesn't answer the question. So you might be like, oh, boom, I know that's like correct, but maybe that's not the question that they're actually answering. So it's really important to like read through the question a couple of times before you answer it. A lot of the questions on the CNSC exam, well, I shouldn't say a lot, but several are going to be case study based. So they'll give you a case study and then you'll have 4 or 5 questions based on that case study. So one question in the case study might actually jog your memory about another question. You might be like, oh, that's what they're asking. Okay, I talked about guessing. And then again, sometimes one question will jog your memory about another question, which is why I encourage you to go through all of the questions in sequential order before you guess. Go through them all, then take a stab at your flagged ones, and then at the very end, you're guessing, because sometimes one question will remind you of something else. Oh, zinc and copper, that's what they're talking about. I couldn't remember that. Now question 3 makes sense to me. And then sometimes they're going to ask for the best answer. Typically, if they don't specify, they're looking for the best answer. Sometimes they'll ask, what would you do first? The best answer versus what will you do first are actually different. So for example, the best answer, like the gold standard for unclogging a clogged NG tube, would be pancreatic enzyme, right? But that's not actually what you would do first. What you would do first is put in warm water and then plunge, right? So really think about best answer versus what would you do first? What are they actually asking you? Okay, if you don't have a study buddy or a study group for this CNSC exam, I would strongly encourage you to get one. You've got a couple weeks before your exam, maybe longer. Group study can be super helpful at the end. I don't like group study for the whole time. I think so much of this exam you need to study on your own because your own personal learning style matters. And sometimes group studying can just be really distracting. But one awesome thing to do with group study is to practice flashcards together. You can also do practice exams with a friend. And talk about the answers with them because you might not understand something that your friend might. So for example, when I studied for my exam, the first time around, I was pretty weak in medications. They just didn't stick in my brain. I didn't have a lot of exposure to them, but I studied with a friend who was really good at medications and I was really good at math. So I understood parenteral and enteral math backwards and forwards, and I was able to help teach her the math section. So we would do practice exams. Back in the day, we basically would just take the Aspen core and read it cover to cover because that's the only option back then. And it was like so much content, and it took us like a year and a half to read the whole thing. We would just take so many notes on the Aspen core, and we tried to read like a chapter a week. And then we would take the practice questions that are in the Aspen core and we'd type them into a Word document. And then we'd print out the Word document and try not to look at the answers and like exchange practice tests. It was like very homemade and DIY. So if you buy my CNSC exam study guide, you'll get practice exams. There's 12 practice exams that are instantly graded online, over 400 Quizlet flashcards. And flashcards really are the secret to passing this exam because they are the best way to remember all of this content and especially these numbers. There's so many numbers that you have to memorize. My flashcards are awesome. And then you'll also get the full, the course, all the videos that come with the course, the TPN calculation cheat sheet, the video module that teaches you about TPN calculation, and then of course the 80-page study guide. The other thing that came up in the Instagram live that I did recently where students were asking, they asked about acid base and reference values. So another really important thing is to look at reference ranges for common labs. So you might not even think about this, but your charting system probably will show you if a lab is low or high. So you probably don't even know off the top of your head, what is a high sodium? What is a low sodium? What is a high pH. What is a low pH? Because your charting system might just tell you it's high or low. So look at reference ranges for common labs. It's in the first part of my study guide in the clinical basics section. And then these acid-base balance quick reference cards, this is really important to memorize. So this section above here shows you reference ranges for pH, PCO2, bicarb, and O2. And those are really important to memorize because they could give you a case study and show a patient's lab and be like, metabolic acidosis, metabolic alkalosis, respiratory acidosis, respiratory alkalosis. What is it? And those are hard. Those are really hard. But in the last few weeks before you take your exam, study these cards backwards and frontwards. There's acidosis and alkalosis. They're color-coded. I am a teacher. I taught college nutrition for 5 years, and I'm a lifelong learner. I've taught so many interns, and color really does matter. I'm very visual. A lot of students are visual learners. So I've color-coded these so that you can actually kind of see it, like your brain sort of remembers those colors. So these are really, really helpful. So reference ranges for certain labs are a super important thing to review in these last few weeks. And then also sodium. So hyper and hyponatremia and fluid balance. There's a big section in this study guide about that. Okay, so group study in the last few weeks, you might do practice exams together. You might do some flashcards together. You might like quiz each other on concepts. That can be super helpful. Saying key concepts and terms out loud can help. I know it kind of sounds a little crazy. Some people find it really helpful to record a voice note. So they'll just list out a bunch of things, read out a bunch of things in the study guide, and then as they're taking a walk, they can listen to that voice note to get some audio feedback. If you're an auditory learner, that can be really helpful. The teach back method is also really helpful. So now in the last few weeks before your exam, grab a friend, or it doesn't have to be somebody who really understands nutrition even, and just explain acid-base balance to your child or spouse or roommate or friend or parent. Like, just call up your mom and be like, I'm going to talk through acid-base balance. I'm going to try to teach this to you, because truly the method of teaching somebody something really helps solidify that in your brain. If you're able to teach somebody acid-base balance and explain this to them, guaranteed you'll get those questions right on the exam. Okay, study right before bed. I know this is a bit controversial because a lot of experts recommend not studying before bed, but hear me out. Instead of scrolling on your phone before bed, in the weeks before the exam, study a little bit right before bed. I always did this before any exam that I took, and it is so effective. I'm not joking. Literally take one page from the CNSC exam study guide. It's 80 pages loose leaf that you put in a binder. Okay, so you can take these pages out. You can take let's take page 75 out, and it talks about experimental study design. Take all the pages out that you really need to focus on in the last few weeks, unpin them from the binder and put them in the front. And then before bed, one page. You're not reading pages and pages or chapters and chapters. You're going to read one page of content. You're not going to be on your phone. You're not going to watch TV. You're literally going to read through the page once, twice, read out loud once or twice, close your book, and go to bed. There's actually science that says it'll help you solidify memory as you're sleeping. So you don't even have to do anything. Your brain will remember content as you're sleeping. How cool is that? As long as you look at that and that only before bed, and then don't look at anything else. Don't learn anything. Don't go on social media. Don't read a book. That's the last thing you do before you go to bed. If you do that every night before your exam, you'd be surprised by how much you can memorize in a short amount of time. Okay, I want to talk about medication compatibility with parenteral nutrition. This is really important. So some medications are incompatible with total nutrient admixture, TNA, or 3-in-1 PN, because they form dangerous precipitates when they interact with the lipid portion of parenteral nutrition. So it really depends on the type of lipid that you're using. This is really more of a pharmacy level thing. You'll have to ask case by case, drug by drug, facility by facility. The pharmacist will probably look this up in Micromedics or another system to determine exactly which medication and lipid you're using specifically, but there's a couple classic ones. Last year, I did the Aspen American Society of Healthcare Pharmacists Nutrition Support Certificate program, and this is some information from that program that I found to be really useful. It was a very helpful pharmacy level certificate program. I learned a lot about parenteral nutrition, compilation and safety and medications and things like that over and above what you might learn in like an Aspen course. It was really, really cool. But they talked about this in the course. These are kind of like the classic ones that aren't compatible with lipid. So acyclovir, which is a herpes antiviral, that one is not compatible. And what I mean by that is if you have a triple lumen PICC line, so you have like three things. You can do like IV fluid in one lumen, and then PN in another, and then a drug like dopamine in another. You actually can't put acyclovir in one of those lumens while you're running the PN because they do ultimately combine, and the lipid portion and acyclovir will react. Amphotericin B, which is an antifungal, is another one that's not compatible with total nutrient admixtures. So you could run that simultaneously with the 2-in-1 if you're just administering the dextrose amino acid portion, but you can't run it with the lipid. And now the lipid piggyback of a 2-in-1, we typically run for 12 hours. So you could run that overnight. And then during the day, the patient can get their antifungal with their PN as long as it's a 2-in-1, but you can't run it continuously with a 3-in-1. This is actually really important because you don't want to constantly stop a PN, especially if it's a 24-hour. You don't want to have to stop it for 4 hours so they can get their medications. You really have to be strategic and think about which medications can and can't I give with the PN. You might have to switch to a cyclic PN so that they can get their drugs that they need in the morning and then run PN for the other 18 hours a day. Haloperidol is an antipsychotic that's not compatible with lipid. Heparin, which is the anticoagulant. Lorazepam, Ativan, is an anxiety medication that we often give IV for ICU patients. And ondansetron, which is Zofran, an anti-nausea medication. Zofran, I would say largely we give that sublingual. It's just under the tongue, but sometimes you'll see IV Zofran for patients who can't take even sublingual medication, but you actually can't administer that with a 3-in-1. And then iron dextran is incompatible with 3-in-1 PNs as well. So if you haven't grabbed my CNSC exam study guide, you can find the info in the link below. Also, I posted a really cool Canva. It's kind of like a live survey with 11 practice questions from Aspen, but you can kind of click through them and see the correct answer in real time. So that link is below as well, so you can practice with a few practice questions.